Excited for a COVID update. I was infected back in August and it was pretty bad, and I had light symptoms relative to more extreme cases. Let's just jump into COVID for a minute. I want to make sure that we do cover the articles today. So let's start with this article from The Guardian. COVID on the rise as experts say that England has capitulated to the virus. Immunologists push for increase in testing and more widespread vaccine booster rollout as a new variant, XEC, emerges. And so this is just from today, actually. And so this is about England, but this is not, exclusive to England. Similar kinds of things exist in the U.S. COVID is on the rise in England, and experts have warned that more must be done to prevent and control infections after a, quote, capitulation to the virus. Professor Danny Altman, an immunologist at Imperial College London, said that those working in the field were perplexed by the current attitude to the battle against COVID, as the latest figures showed an increase in hospital admissions. The latest data for England from the UK Health Security Agency showed that hospital admissions increased to 3.71 per 100,000 population for the week between 16 and 22 September 2024. So last week, compared with 2.56 per 100,000 the previous week. The percentage of people with symptoms who have tested positive for COVID based on tests at Sentinel Spotter Laboratories has also risen in the last week to 11.8% compared with 9.1% in the previous week. Altman described the prevailing stance on the virus as a capitulation. Quote, to those who work in this field, the current attitude of acceptance to losing this war of attrition against COVID is puzzling and a little bit desperate, he said. So that is the attitude overall. When was the last time you heard anybody in the U.S. government at any level really say anything about COVID? And for all of the, they were talking a couple of years ago, maybe even last year, about don't lump this in with the flu. That's exactly the approach that they take to the shots now, where you get a new COVID shot each year, and one per year, even though the mRNAs do not hold up for a whole year. They're really most effective for about 3 months, and then they really drop off. It's better than nothing, but one a year leaves you exposed for at least 6 months to 9 months out of the year. Really not an effective strategy. And so really implicitly then, the U.S. is just trying to regulate everything based on infections, which is, that's capitulation. I mean, that's definitionally, you're just relying on immunity from the infection if you survive it. What's the problem with that is that every time you get infected, there are serious problems. It's doing a lot of damage in your body, and sometimes more than other times, and there are different risk factors. But even if you're young, you can, increase your risk of diabetes or a lot of other problems. So let's look at one thing now. I'll keep this fairly short. There's more to that England article, but here's one example. And I think what I want to do on these streams is maybe just do 1 or 2 articles at the top of every stream rather than like a whole segment. Just to remind people, this is an ongoing thing. There's a point where I got sick of talking about this because the science is just showing the same things that we knew in 2020 and 2021 and 2022 over and over and over again. Increased risk of heart attack from infection, brain damage, immune damage, liver damage, all kinds of stuff. We know it. It just keeps getting confirmed. Honestly, it was adding to like my pandemic-related PTSD. That was another thing that they were talking about in the Guardian article was, people don't want to think about it because they have a lot of unpleasant associations with the pandemic. Yeah, but we can't just use the ostrich routine. We have to actually deal with this. That's called being responsible. So anyway, basically just confirming what we already knew. Here's an article, again, from today. COVID-19 causes lasting cognitive impairment tied to brain injury markers. A new study reveals that COVID-19 patients suffer from significant long-term cognitive deficits even a year after hospitalization, with brain injury markers and reduced brain volume. Yes, brain mass shrinkage. Your brain gets smaller. Reduced brain volume, suggesting immune-mediated damage. What does that mean? So part of your immune system is inflammation that can be used appropriately sometimes against infectious things that get into your body. Inflammation is part of your healing response, but too much inflammation can do a lot of damage. And so that's one of the problems with COVID is you get massive amounts of inflammation which damage healthy tissue. And so let's continue on with the article. In a recent study published in the journal Nature Medicine, researchers assessed one-year cognitive, biomarker, and neuroimaging outcomes in post-hospitalization coronavirus disease 2019, or COVID-19, patients and identified factors linked to cognitive deficits and recovery. So cognitive deficits are commonly reported in post-acute COVID-19 patients, so long COVID. But their recovery trajectory and underlying mechanisms remain unclear. The most affected individuals are those with neurological or psychiatric complications, neuro-COVID, though many studies have excluded these patients, just to focus on people that didn't have that, like more general COVID patients. Up to 1/3 of COVID-19 patients experience complications such as stroke, because they cause a lot of clotting issues, and encephalopathy. Few studies have combined comprehensive cognitive assessments with biological or neuroimaging data. So biomarkers is where they will study blood or other bodily fluids looking for particular, like the presence of particular compounds or chemicals that serve as a marker. And it's, biological, so a biomarker indicating something, like it might be the spike protein or whatever. And follow-up data is scarce. COVID-19's impact on the brain is considered immune-mediated rather than neuroinvasive. So in other words, the virus negatively impacts your brain, it harms your brain using your own immune system against it rather than directly invading the brain. Although parts of the brain, like the brainstem, can be directly infected, but largely it messes up your immune system, and then your immune system in turn harms your brain. Though this study notes potential similarities between COVID's brain effects and those seen in other systemic infections. Further research is needed to better understand the mechanisms of post-acute COVID-19 cognitive deficits and identify effective strategies for treatment and prevention. So, this is something I struggled with after I got infected in December 2020, all through 2021. I mean, it's just my mind would go blank constantly. And I feel like that has improved significantly, but it was a good chunk of my life where just my mind was not working as it had. And so, I've taken extreme measures. I still mask to avoid infection. But for people who are getting infected 2-3 times a year, what is this doing to their intelligence, to their memory, to their executive function, to their ability to plan and think long term, to their ability to delay gratification? I mean, it's pretty scary. Do you know somebody who is not the same after getting COVID, either once or repeatedly? Well, it's probably from this. So how did they do the study? Patients aged 16 and older were recruited over 19 months between March 2021 and October 2022 from 17 sites in the UK through the COVID Central Nervous System study, which was part of the National Institute of Health Research COVID-19 bioresource. And informed consent was provided either by participants or their next of kin, I guess for post-mortem studies. The study included hospitalized COVID-19 patients without prior neurological diagnoses. So people who were healthy or at least weren't diagnosed with anything neurologically, your brain and nervous system related prior to getting COVID, with or without acute neurological or psychiatric complications. And so that they have two groups for that. The neuro-COVID group, who had acute neurological complications from the COVID, was identified through neurology referrals or clinician notification. And the without acute psychiatric complications group was matched by age, ethnicity, sex, COVID-19 severity, and admission epoch. So like which wave they got infected in. Some patients attended the emergency department but were not hospitalized. So some people went into the ER but didn't stay. So participants completed a cognitive assessment, the cognitron, between 1 to 26 months post-discharge. This included computer-based cognitive tasks across 5 domains, blood sampling for brain injury markers, and MRI scans. Subjective cognitive impairment was assessed through a binary question. brain injury markers such as neurofilament light chain, ubiquitin carboxyl terminal hydrolase L1, tau protein, glial fibrillary acidic protein were measured in serum using specialized kits. So these are markers that if they show up in your serum, then like the presence of those indicates brain injury. There are certain kinds of proteins and things that your body produces like only when you're injured. And so if they're there, they know that there's been an injury, and in this case specifically a brain injury. Cognitive performance was compared to a normative community sample of about 3,000 individuals matched for demographic factors. Neuroimaging analysis involved gray matter, white matter, and cerebrospinal fluid volume measurements from MRI scans. Data were analyzed using standardized protocols, and multiple regression models were developed to assess the cognitive outcomes. So this is how they did the study. And so what did they find? They analyzed 351 COVID CNS participants alongside a control group of about 3,000 matched by age, sex, first language, and education. Participants had no prior neurological diagnoses and were assessed at a median of 384 days post-COVID-19, so about a year later, year and a month, 13 months, with evaluations including cognitive testing, self-reported measures, neuroimaging, and serum sampling. So objective and subjective measurements. The cohort had a median age of 54 years with 58% male, 78% white ethnicity. Among them, 29% experienced severe COVID symptoms. At the time of post-acute assessment, 84% had received 2 vaccine doses, while 54% had neurological or psychiatric complications. That was the neuro-COVID group, and 46% did not. So it was roughly half and half. Based on their demographics, cognitive testing revealed that both groups performed significantly worse than expected. The deficits were global, spanning multiple cognitive domains, with those affected by encephalopathy showing the greatest deficits, followed by cerebrovascular and inflammatory complications. Okay, so encephalopathy is brain disease. Cerebrovascular has to do specifically with blood flow and to the brain, and then inflammation. Okay. Memory concerns were significantly associated with greater objective deficits in both groups, with a notable increase in memory concerns post-COVID. Both subjective concerns and objective impairments in memory were strongly concordant. So when they say memory concerns, subjective memory concerns, that's the person saying, I am concerned about my memory. Subjectively, to me, it seems like my memory is not as good. And then also objective impairments, like you can measure performance with memory assessment tests and then compare that to the baseline of similar demographics. So this supported the reliability of self-reported symptoms. In other words, the people who were concerned about their memory, it was concordant with the objective tests that they were doing worse. So that was their self-reported concerns were actually reliable. It wasn't like they were concerned, but they're actually doing fine. The people who were concerned also tended to do much worse. So, cognitive impairment was found to be generalized across all domains without evidence of domain-specific deficits. Let's say that again. Cognitive impairment from the COVID was found to be generalized across all domains. Everything that they were measuring for in terms of cognitive performance, it was across the board without evidence of domain-specific deficits. Recovery of cognitive performance showed some improvement early after discharge, but the recovery plateaued during the follow-up with no significant further recovery observed between later assessments, indicating persistent cognitive deficits. So in other words, it got a little bit better after they were discharged, but then the recovery plateaued at a reduced level compared to how it was before. Clinical factors and neuroimaging. The study also examined clinical factors associated with cognitive impairment, symptoms of depression, multimorbidity or multiple illnesses, and brain injury markers, such as those chemicals we mentioned before, were associated with cognitive deficits. So if your blood test showed you had elevated amounts of those markers, then that was associated with worse cognitive performance. And there were higher levels of these markers found in the patients who had significant neurological problems compared to the group that didn't. Notably, multimorbidity and depression played significant roles in predicting cognitive outcomes, with mental health status influencing both groups. So multimorbidity, meaning having multiple things wrong, and depression was able to predict the cognitive outcomes. So if you had those, you were likely to do worse with the cognitive outcomes. Additionally, structural brain changes were identified through neuroimaging with reduced anterior cingulate cortex volume. So we're talking about reduced brain volume. Your brain shrinks from COVID. And just to put this up on the screen, because like I said, we've known this for a really long time. Here's an article from April 2022. This was published in National Geographic off of a scientific article. Even mild COVID-19 can cause your brain to shrink. We've known this for 2.5 years. So for me, I look at that and I go, yeah, okay, I'm going to avoid infection. I don't know, what it's going to take for people if that's not swaying them. Like, my brain, it's almost too big. I don't mind if I lose 10% of my brain or age it 10 years. Yeah, that's fine. I got plenty to spare. Yeah, no, you don't. You don't. Most people could use, more brain, not less. But for real, like, don't damage your brain. You really need that. And like I said, most people, struggle a little bit, my perspective. Anyway, let's not go reducing intelligence with brain damage, avoidable brain damage, if you just wear a fucking mask. Wear an N95, then nobody catches what you have, and you don't catch what they have. Trust the mask. Those masks, they're called N95 because they reduce at least 95% of particulate matter down to the viral level. It can filter out things that small, and that's great. You want to do that. Actual testing, we did a University of Maryland study in a previous video that showed that 98%, even when people were shouting, wearing a mask, they were shouting at the top of their lungs, the mask was filtering out 98% of the viral material that they otherwise would have been expelling into the air. So just wear a fucking mask. The kind of just absolute, how politicized it's become and how people allow themselves to get wrapped up in the peer pressure of, not taking adequate medical measures during a pandemic just absolutely sickens me. I don't know what to say. It's like, is there hope for the species that you think that like owning the libs or, pretending everything's normal and going to brunch, whatever, is more important than stopping the spread of a disease that's impairing immune function and causing brain damage? To me, that's like stop the world. I want to get off. Like, is there another planet I can go live on? That's roughly like how I feel looking at a situation like that. Anyway, going back to this, so that reduced brain volume found in this study was linked to impairments in cognition, memory, and attention, things a lot of people are already struggling with, and it suggests that the cognitive deficits may be related to disruptions in the brain's attentional and emotional processing networks. Great, because again, it's not like, there's a mass shooting, like, what is it, 2 a day or something on average in the United States right now? I mean, which is partly political. But I don't think people need any more of a problem processing their emotions, Anyway, the multifaceted models for both neuro-COVID and COVID groups revealed that age, multimorbidity, and brain structure abnormalities were significant predictors of cognitive outcomes. The study highlights the need for further research to better understand the cognitive impact of COVID-19 and guide therapeutic strategies. You know what? Therapeutic strategies, totally appropriate for people who got affected in the first year, before we really knew anything. We know now. Wear a mask, get vaccinated as a plan B in case you have a mask failure, but wear a mask, you won't get infected. And then you don't need the fucking therapy. But when you're relying on this, quote, COVID is over, as COVID is actually going up to unprecedented levels of spread, yeah, you're going to need therapy for this entirely preventable thing that you just got swept up in the peer pressure to, not mask or whatever. Anyway, so the conclusions, so this prospective national study of 351 hospitalized COVID-19 patients, and we will say that if you're hospitalized with COVID, your odds of long COVID and all these complications go way, way up. If you're not hospitalized, your odds of this are lower, but there's, I wasn't hospitalized, and I had pretty significant impacts for like a year or two. Actually, cognitive impacts for like a year, I definitely felt better after that. My immune system was impacted. I was having immune related problems really for like 2.5 years. Might still be having them, but it was definitely for 2.5 years afterwards. Because it affects your T cells, it attacks and kills T cells. Only other virus that does that is HIV. It's not exactly the same as HIV, but it does attack your immune system in a similar way. We'll have another article on that the next time that we get into this. But anyway, there's the journal reference at the bottom. I mean, I could keep reading this, but it's like, how much more do you need to hear? Either you care that, there is widespread brain damage going on and you're contributing to its spread by not masking, not doing air filtration, not doing all the other things that are easy and cost effective to do because you want to be normal. You want to live in, I don't live in fear. Well, I think you actually do live in fear because you're succumbing to peer pressure to not take simple, cost-effective measures. Masks are cheap. You can order 20 packs for like cheap online. Get N95s. It's so simple, but people won't do it. And I know where I live, it's maybe 1 in 200 people mask. I get occasional, scowling from people for masking. You know what? I'm not really interested in the opinion, truly, of people who are going to think badly of masking at this point in time. I don't care. I don't care what you have to say. If you're that ignorant, if you're that politicized, if you're that warped, I really don't care what you have to say. So, scowl on, glare on. I don't give a shit. You're making my life easier by just filtering out people I don't need to listen to. But there you go. I don't know how much more people need to hear on this, but we'll keep it to that for now today. And that's that. This has been your COVID update for today.